Hello, and welcome to today's discussion, all about understanding infant feeding disorders and their misconceptions. Today, we'll delve into this topic, explore functional gastrointestinal disorders, and understand the distinctions between lactose intolerance, cow's milk protein allergy, and common feeding disorders. Join us as we shed light on the importance of precise diagnosis in pediatric healthcare. Let's get started. Let's start by addressing the issue of overdiagnosis. According to research, official guidelines for detecting cow's milk allergy have led to potentially inflated diagnosis rates. This has resulted in substantial costs, with specialized formula prescriptions in the NHS exceeding £11 million between April 2021 and July 2022. A recent study published in 2020 found that while up to 14% of families believe that their child may have a cow's milk allergy, the reality is that the true number of children with a condition may be closer to 1%. The same study points to official guidelines for detecting cow's milk allergy as a possible cause for the overdiagnosis. The research analyzed 9 official medical guidelines for cow's milk allergy published between 2012 and 2019. These guidelines were sourced from a range of international medical organizations across Europe. The study found that many of these guidelines cited symptoms such as excessive crying, regurgitating milk and loose stools as an indication of cow's milk allergy, all symptoms that are very common in normal, healthy babies. Now, let's discuss functional gastrointestinal disorders. What are they? An FGID includes chronic or recurrent symptoms in otherwise healthy individuals that cannot be explained by any obvious structural or biochemical abnormalities. A functional condition is one that impairs the normal functioning of bodily processes without there being any apparent abnormality. For example, motility, peristalsis, and microbiome or valve competence. Infant feeding disorders are a common occurrence, with up to 50% of infants aged 0 to 6 months presenting symptoms of at least one functional gastrointestinal disorder. It isn't surprising that it can be difficult to make an accurate diagnosis. Lactose is the sole carbohydrate, which is sugar, found in breast milk, and is also in most infant formula. An intolerance is defined as difficulty digesting certain foods accompanied by unpleasant physical symptoms. It is important to note that an intolerance does not involve the immune system and is therefore a non-immune mediated response. Lactose intolerance and FGID often present with similar symptoms to a non-IgE mediated allergy, and it can be challenging to differentiate between them. A food allergy is a reproducible adverse reaction to the protein in the food. A food intolerance is a reaction to a carbohydrate component, such as lactose. The most common ones in 0 to 6-month-old infants are colic, 5 to 20%, constipation, 3 to 27%, and GOR or regurgitation, 30 to 67%. In cases where these common symptoms are presented, practical feeding advice and reassurance to parents provided early on could omit the need for inappropriate prescribing of specialist formulas and medications. So what is lactose intolerance? Well, first we need to establish what lactose is. Lactose is a disaccharide sugar made up of 2 monosaccharides, glucose and galactose. Lactose is broken down by the enzyme lactase, which lives in the brush border of the duodenum, the first part of the small bowel. Lactase levels are at their highest at birth, which accounts for why breast milk is so well tolerated by infants. Levels of lactase tend to reduce as we get older. The level of lactase that is produced depends on the levels of lactose we consume, thus often making symptoms dose-dependent. So let's talk about symptoms, testing, and treatment. A stool pH test and checking for fecal-reducing substances can be helpful. Increased levels of carbohydrates, sugars, in the stool can indicate a specific sugar malabsorption. These are often difficult to accomplish, however, as a fresh stool sample needs to be in the laboratory within the hour. A normal stool pH is about 6, whereas less than 5.3 is deemed acidic and indicative of a sugar malabsorption. Secondary lactase deficiency is the most common cause of lactose intolerance in the United Kingdom in babies and children. This deficiency is an acquired lactose intolerance and tends to present itself following damage to the digestive system, and specifically the brush border where the lactase lies. Typically, this is identified following a gastrointestinal bug, a long courses of antibiotics, or through conditions such as celiac disease or Crohn's disease, and only requires short-term low lactose intake to allow lactase to start reproducing. We know there is a strong crossover of symptoms with lactose intolerance, CMPAs, and common feeding disorders that affect a substantial number of infants. The key to properly treating the situation lies in healthcare professionals having the correct knowledge to make an informed diagnosis. Although the research discussed shows that the true incidence rate of CMPA is lower in comparison to other FGID, the prescribing costs of extensively hydrolyzed and amino acid formulas to the NHS are increasing very significantly. In many cases of colic, reflux, constipation, and possible lactose intolerance, infants can experience relief of symptoms from a reduced lactose, partially hydrolyzed formula. If an infant is presented with feeding difficulties, healthcare professionals should consider the different possible diagnoses before prescribing a more medicalized formula. If healthcare professionals can be afforded the appropriate education and resources to properly navigate the process of diagnosis, we stand to reduce the number of infants consuming food for special medical purposes and reduce the cost to the healthcare system. Thank you for joining us today for this informative discussion on making accurate diagnoses in infants. For more information and studies, be sure to check out our healthcare resource hub to learn more.